I believe that we live in a time now where development goes in two different directions at the same time. A lot of things in the world are getting better, but in the same time, we also see huge challenges ahead of us. The war in Syria, the situation for the refugees, the climate change, which, the climate meeting starts today in Paris. And I think one concrete example on how development simultaneously goes in two different directions is the global healthcare. We see, as Katrine spoke about, many previously poor countries increasing their gross national income, their GNI, and moving into being classified as so-called middle-income countries, which means often decreased grants, decreased aid and donor support. More is supposed to be covered by the countries themselves. But, as all of you know, some more than others maybe, increased GNI doesn't automatically mean that more money goes into the health sector. And today we have a reality in the world where 70% of the world's poor and sick live in middle-income countries, where the three major killers are HIV/AIDS, tuberculosis and malaria. And there are giant challenges facing both these countries in battling the disease and also the donor and the NGO communities on how to work more efficiently with these diseases in these countries. And we're here today to focus on one way that could be the way forward maybe in replying to these challenges, and that is supporting the system of the lay counselors. And we'll talk more specifically about that after 11. And we'll start now with the fight against HIV in a changing world. HIV/AIDS used to be on top of the news agenda, especially when we talked about sub-Saharan Africa. Me, myself, I did so many reports on HIV/AIDS, many stories on TAC, for example. I'm happy that you are here today. And nowadays, we rarely hear about it. I've been asked why I'm having this on me, because a lot of people tell me, but AIDS isn't really a problem anymore, is it? But you all know that that is a problem. We need to keep it on the agenda. There is still 1.2 million people dying from AIDS or AIDS-related diseases every year. And I'm happy to present to you Mr. Tobias Alfvén, medical doctor and senior researcher on global health at Karolinska Institute. And he will provide us with a map on how the current epidemic looks like. Welcome.
Thank you very much, and good morning, colleagues and friends. And first, a big thanks to MSF for organizing this day. And I think World AIDS Day, it's always an important day, but it's even maybe more important this year, 2015, the end of the Millennium Development Goals and the beginning of the Sustainable Development Goals, with all the possibilities, but also challenges, like you said now. So, let's see if my slides are here. Yeah, that's my slides. So, I've been asked to setting the scene and painting a map of the current epidemic. And in doing this, I would like us to move back to the year 2000. And the fireworks, they had just stopped, and the world was preparing for the Millennium Summit. And in less than 20 years, AIDS had spread to all parts of the world. It had shown it had a devastating effect on many countries, especially in sub-Saharan Africa. And on the first page of the UNAIDS Global Report Year 2000, it was written, AIDS in a New Millennium, a grim picture with glimmers of hope. And almost all the curves were going in the wrong direction. In the year 2000, every year, there were 3 million new HIV infections, of which more than 500,000 were among children. And less than 1 million people got access to antiretroviral therapy. And there were even colleagues, exactly like you said now, Katrine, that were challenging that it would be good to actually provide people in sub-Saharan Africa with it. They said, no, it's not worth it. It's too expensive. We shouldn't do it. And at the same time, because of that, 2 million people died because of AIDS-related causes every year. And still, less than $5 billion were spent on AIDS every single year. And also in the year 2000, 92 countries in the world, they were criminalizing same-sex relationships. And if you took an HIV test, it took you 3 days to get the result. And in the year 2000, if you were lucky, to actually get access to ART, you needed to take an average 8 different pills. And if you got these 8 pills, you or someone else had to pay $10,000 a year to get that. But as I said on the first page of the UNAIDS global report, there were also glimmers of hope, and pushed by civil society. And I really think civil society did something great in moving up to the year 2000, telling world leaders that we can't miss this. It's something special. The new millennium, we need to use this. And thanks to civil society and Kofi Annan, I would say almost all world leaders met for the Millennium Summit in New York and agreed on the Millennium Development Goals. These 8 goals, of which 3 were directly related to health and 1 of them directly to AIDS, MDG 6A, have halted by 2015 and begun to reverse the spread of HIV/AIDS. And what happened then in 15 years? New HIV infections from 3 million to 2 million a year. Among children, the decrease is even larger, down to a bit more than 200,000. And people said, no way we can't get more people on ART. But now we have more than 15 million people in 15 years' time on ART. And AIDS-related deaths, they have been decreased to 1.2 million, and the investment for the AIDS response, it's up to $22 billion a year in just 15 years' time. And people also say you can't change how countries actually have laws, but it's possible. Look at it. The number of countries that criminalize same-sex relationship from 92 down to 76. We've even managed to do this, not just getting people on treatment. And also, it took you 3 days to get an HIV test result, right? Now it's 30 minutes. And at the same time, now people, more than half of all the people actually needing ARTs, they get it. And instead of taking 8 pills a day, most of them can take 1. And the cost from 10,000 to first-line regimens in low-income countries to $100 a year. So if we look at it, did we manage to halt by 2015 and begin to reverse the spread of HIV/AIDS? Well, the decrease in new infections is 35%. Among kids, it's even 58%. And AIDS-related deaths down by 42%. So we must really celebrate and say, yes, we managed to fulfill the MDG 6A. We did reverse the spread of HIV/AIDS. However, if we look at HIV this year, and some people, as you said, why do we mirror the pin? No, the AIDS epidemic is not over. If we look at the world map today, or actually at the end of 2014, where we have the latest data, 37 million still live with HIV, and the large majority, 2/3, in sub-Saharan Africa. And this number, it's increasing every year due to that more and more people get access to life-saving therapy, and they're living healthier and better lives. So some people, when they say, oh, you just see the curves, they go in the wrong direction, more and more people live with HIV. Well, we want people living with HIV to stay alive, but we don't want more people to get infected. And sometimes that's complicated to explain for people outside this room, not in this room. And if we look at the number of new infections, as I said, is down to 2 million, but still 2 million new infections of something that actually more or less possible to prevent. It's a shame. And again, 3/4 of that almost is in sub-Saharan Africa. And if we look at it, we know that some people are particularly vulnerable to HIV. Men who have sex with men are 19 times more likely to be living with HIV than other people. People who inject drugs, 28 times more likely. Sex workers, 12 times more likely. And transgender women, 49 times more likely than the general population to live with HIV. And if we look at it globally, of the 2 million new HIV infections, approximately 30% are among these key population. 4% sex workers, 6% people who inject drugs, 18% men have sex with men, and about 7% clients to sex workers. And in a majority of countries outside sub-Saharan Africa, a majority of people getting infected in 2015 are among these key populations. And still, we said it had decreased from 2 million to 1.2 AIDS-related deaths, but it's an awful lot, 1.2 million people dying each year because of something that we again can prevent. And again, a majority of this, 2/3, it's in sub-Saharan Africa. So we see HIV continues to shine a harsh light on the inequalities of the world, and AIDS, it's an unfinished business. And we know the MDGs, they will actually end now in exactly 31 days, right? Because the end date of the MDGs, now people have stopped talking about it, but they're actually not completely over. But we now have the new development agenda, the Sustainable Development Goals. And some people, they say that, oh, health is not very much in here any longer, but health is almost all in here. And it's showing even better how everything is related. You can't have a healthy development without having a social, economic, environmental development together. And some of the 17 goals, they're more related to the AIDS response. Of course, SDG number 3, good health, it's also there we can find the directly new AIDS goal. Gender equality, it's a core goal in here as well. Reduced inequalities, peace and justice, and partnerships for the goals. And I really think that we need and we can and we must use the SDGs as the framework. And as we can see, the new UNAIDS strategy is based around the SDGs. However, to reach the SDGs and actually reach the end of AIDS, we need to be smarter. We need to look different. And we often, when we talk about the AIDS epidemic, we talk about that the prevalence in country is this and the incidence in country that is that. But that's not enough. And this is a map of Kenya, showing Kenya, we all know here. And these are showing the 47 different counties in Kenya. And the darker the green, the higher the number of new HIV infections every year. Approximately, there are 60,000 new HIV infections in 2015 in Kenya. And in the small counties here in the dark green, there are more than 5,000 new HIV infections. And in the large areas here, it's just 250 or less than 250 new HIV infections every single year. So, what we have shown, UNAIDS, together with the Kenya Ministry of Health, is that if we continue everything as normal, there will continue to be approximately 60,000 new HIV infections every single year. If we instead roll out a true combination prevention, combining prevention efforts together with a rollout ART program, that will be decreased to maybe 20,000 a year. But if that is combined with a real geographical prioritization, really targeting the areas where you have most people living with HIV and the highest transmission, and also looking at key populations in these groups, you will reduce it down to 10,000. We cannot continue doing business just because we said, oh look, we were so good in the last 15 years, let's continue. No, that's not enough. And as I said before, key populations, and for example, especially people who inject drugs, it's very difficult and many countries neglect them completely. And it's punitive laws, it's fear, it's stigma, it's discrimination, and it's even violence. And people injecting drugs, it's a very, very difficult life. And if you look at it from the HIV angle, it's also in many countries neglected, and people say, no, we can't do this. And just look at what happens sometimes in Sweden when we talk about people who inject drugs. But some countries are more pragmatic, and if you will look in Yunnan in southern China, it's here in southwestern China, it's one of the provinces most hardly hit by HIV in China. And they looked at the map, and again, the darker the green, the more people living with HIV, and most of these infections are due to injecting drug use. And then you see the numbers, and then the numbers in parentheses. It's the number of methadone clinics and the number of people on methadone maintenance. And it's exactly, they looked, okay, here we have many people living with HIV and a lot of drug users. Then we should target these provinces. It's again being very pragmatic, targeting the AIDS epidemic where the epidemic actually is. And these are just two examples from the new UNAIDS World AIDS Day report, focus on location and population and how we think and how things should be done differently if we want to achieve something in the coming 15 years. And I would like to finish with a quote from UNAIDS, which I think summarizes this very, very well. Ending the AIDS epidemic is achievable if we focus on people accessing the right services delivered in the right places. Thanks.
Thank you. I think you can have a seat there on the second chair is your name. And you can actually bring the microphone with you. Can I just ask you one short question?
Of course.
On when you were showing the map of Kenya and you could see the high numbers of new infected in the western parts of Kenya, would you say that rolling out ARTs there would manage to decrease those numbers, or what would be the quick fix?
I don't think there is one quick fix, and I think that's really what the lessons learned are. You have to combine it, but I think ART is one of the critical components, and rolling out ART with community mobilization and also getting prevention working together. And I think that's, again, we need to talk about combination prevention. Some people in some countries believe that if we just roll out our ART, we don't need to do anything else. We don't need to talk about structural issues. We don't need to discuss laws, but it's not enough. If people are still afraid going to the clinic, getting their pills, of course it's not enough to roll out. People have to be, and actually be, okay, it's fine, you can go and take an HIV test, and it's okay to discuss it. So I think it's the combination prevention.
More healthcare in that area combined with ARTs, combined with information, and would...
That's a very good start, yeah.
Yeah, great.
But again, looking at the map, where is the HIV epidemic? And not just saying that the prevalence or the incidence in this country is this, and then rolling it out the same. That's really hindering the response, and I think that's very important. And that's also that we have been better now. It was difficult to get granular data like this, but it's getting better and better, and that we use technology, and we use mobile phones, etc., that we'll hear more about later today.
Great.